Aging and exposure to environmental stresses like ultraviolet light will cause progressive changes in the structure and appearance of the skin. And this often reflects changes in the extracellular matrix, which is the components which make up the dermis, the thicker, tougher layer of the skin, but also the deeper structures such as the fat and the ligaments that support the surface of the skin. All of these changes taken together is what we perceive as facial aging. And for some people, this is an undesirable change in their appearance. And there's lots of things which we can do to actually mitigate this or improve it. So firstly, talking about dynamic wrinkles. What we mean by dynamic wrinkles is wrinkles that form when we move our face. So for example, on the upper face, when I'm lifting my eyebrows, now you can see that I'm forming wrinkles here, or if I screw up my eyes, I've got wrinkles around the edge. When we're young, actually our skin is so elastic and it doesn't form permanent creases. But as we get older, then we lose collagen, we lose elasticity in the skin. And those dynamic movements will then create increasingly deep creases. One way that we can mitigate this is to reduce the movement, particularly of these muscles on the upper face. And treatments which can achieve this is things like botulinum toxin, which is a very effective treatment and generally very safe treatment, and it will reduce the movement. I generally don't aim to prevent the movement altogether, I just aim to reduce the movement, can soften the lines, and importantly can actually then by doing so it can prevent new lines from forming. So it's a prophylactic treatment as well as a treatment for the lines which are already there. Moving on, one of the other really big changes that we see is loss of volume or changes in the facial fat compartment. So generally in a younger face, we'd expect to have more volume up towards the top of the face, in the cheeks, in the mid-face. In an older face, we lose this volume as a consequence of loss of fat, but also of changes in the position of the fat pads themselves due to ligamentous changes and to redistribution of the fat. And we often gain fat around the lower part of the face. A good way that we can address this loss of volume at the upper part of the face is dermal fillers. Generally, when I'm using dermal fillers, I like to use hyaluronic acid-based fillers. I consider these to be the safest because they can be reversed if needs be. What I'm looking to achieve with dermal fillers really is to replace volume which has been lost. I'm not seeking to overall change the appearance of the face or the shape or structure of the face, but to replace volume that's been lost as a consequence of the aging process. And used in this way, we can achieve very natural results. We're not aiming for an overfilled look. We're not aiming for an appearance of looking different from how you are, but just simply restoring that volume that's been lost. And then other changes that we can see with aging, we see that you often can get more redness, you can get more prominent blood vessels, and you can get pigmentation. And all of these things can be addressed with laser treatments and intense pulse light treatments. So overall, there's a number of effective treatments for skin aging. If you come to see me in the clinic, then I'll help you to weigh up the pros and cons of those different options and to find a tailored solution for your specific concerns.